A new, more contagious variant of the coronavirus has been discovered in Colorado and California. We know this particular mutant was first discovered in the UK in September. However, cases are now being reported in several countries worldwide. This comes as infections and hospitalizations surge across the United States, even as vaccine rollouts get underway. So for more on all of this, let's bring in Dr. Stanley Perlman. He's a professor of immunology and microbiology at the University of Iowa, where he's also a pediatric infectious disease physician. Quite a mouthful, but we appreciate having you with us, Dr. Perlman. You've, of course, studied coronaviruses for decades. What can you tell us about this new variant? Why is it more contagious? You know, I've heard from people it's because there's more virus potentially inside someone, but it's not making it more deadly.
Yeah, so all we know is, what we really know is that this virus seems to be taking over populations of the virus infections. So where before we might have had other viruses infecting people primarily, in places where this virus is found, it seems to be, as it were, winning the fight to infect people. But we also have no evidence, as you mentioned, that it causes a worse disease than any other form of the COVID-19 virus. And we don't even really understand how it's spreading so quickly. You mentioned that it seemed to be at higher levels in people who are infected, but I'm not sure we have really solid data for that.
Interesting.
And we don't know how well it spreads to other people as well.
I suppose there's just many theories at this point as to what is happening. Dr. Perlman, what's the best way to protect ourselves from this new strain? If it's more contagious, you know, I'm wondering, do the cloth masks I've been wearing around work? Is hand washing, hand sanitizer, is this enough to fight it, or do we need more protection?
Yeah, so as far as we know now, it's exactly the same as the protection that we would need against the old strains of COVID-19. Hand washing, social distancing, wearing masks, those are the ways that we can protect ourselves from this virus. And in fact, if you have two people, one infected with the wild type virus, one with the new virus, one's wearing a mask, the other's not, the person who's not wearing the mask, depending on either a virus, will be more likely to spread the virus or become infected.
Interesting. Will the vaccine still work against this new coronavirus strain? I'm hearing a lot of people ask this question.
Absolutely. So far, we have no evidence that the changes we see in the virus will affect vaccine efficiency. So that's still something that's being worked at, whether there's a slight difference in response. But so far, nothing that should be worrisome to anyone.
You know, we were talking earlier where this variant popped up in the United Kingdom, and what we were learning from our reporter Charlie D'Agata there is that this seems to be spreading much more quickly among children. Do we know how this does impact children?
Yeah, so I don't think we do. I've heard that too, that it infects children more than the old strains do. But I think that the information on that is still also just being gathered. So I'm not sure we know how much of an impact it has. I haven't heard any evidence that it's causing a worse disease, but maybe it's infecting more children. I think we still really don't know.
Just like much of this pandemic, so many questions. You know, when it comes to the vaccines, many people looking at this as light at the end of the tunnel. Can you explain, because I don't know that people necessarily understand fully how the vaccine works. You don't just get it and you're immediately, you know, immune from getting coronavirus. In some cases, you're going to need 2 doses. And also, if you're in a household, I have a friend who's a nurse. She's receiving her vaccines right now, but her family isn't. Can you piece together and describe to people, you know, who's protected, who's not once these vaccines start rolling out?
Yeah, so what we think is happening for sure is that a person who's vaccinated is going to be protected from severe disease and, in fact, from any clinical disease. But what's not known yet is whether these people can still become what we'd call mildly infected or subclinically infected and spread the virus to other people in the same household. So we don't know if the vaccine protects against that. And if the person who's vaccinated should be protected, but we're not sure how long that will last, whether it'll be a year, 5 years, 6 months. This is still something that we don't have information for.
So I've been watching Florida very closely. I have some family and friends who live there. I lived there for a long time. We're seeing Florida roll out its first come, first serve vaccine distribution for seniors in several Florida counties, specifically areas that have a high number of seniors living in them. Some of these elderly people are waiting in long lines, even camping out in the cold to receive their vaccine. I have to believe that there's a safer or better way about going about getting a vaccine.
Yeah, well, I would agree with you that if things are done properly, people are offer the vaccine in a logical order so that they can make an appointment, come in, get vaccinated. I know that's what we're doing at the centers here in Iowa. So there are better ways to do it. Certainly having senior citizens signing up and camping out is, in a way, a good thing that they're interested in getting the vaccine, because there's so much worry about vaccine hesitancy in this country.
It makes me worry, though. I've been in lines before to get tested, and you have to wonder what if people around you are infected with coronavirus as they're waiting?
Yeah, so of course that's a worry. And since you're standing in line next to the same person potentially for minutes to hours, yes, that's something to think about. I think the one possibly ameliorating factor is that people who are outside are less likely to become infected because of the virus is less able to spread from person to person. We know that it does much better inside in areas with poor ventilation. So outside gives you a little bit of protection, but your point is still well taken.
Okay. Dr. Stanley Perlman, we appreciate you being with us.
My pleasure.